Hello and a very good afternoon to all of you. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be taking good care of yourself. Today we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at one point of time in our lives. Urticaria is characterized by a round rash that itch a lot, and the causes could be anything. We will learn about it from our skin expert today. So today, let me introduce our skin expert. We have with us renowned skin specialist, renowned dermatologist, Dr. Amee Daxini. She is MD, Skin Diseases, DNB Dermatology and Venereology, MBBS Dermatologist, Cosmetologist, Aesthetic Dermatologist. She has 22 years of experience overall, 21 years as specialist in this field, and her skill and compassion have made a tremendous difference in patients' life. Dr. Amee is the founder and senior consultant at Think Skin Clinic, Bangalore. She is a dermatologist and conducts regular training for dermatologists in advanced procedures. A very warm welcome to you, Dr. Amee Daxini. It's such a pleasure to have you with us.
Thank you so much. Thank you. My pleasure.
Pleasure is all ours, Doctor. And today, as we are going to talk about urticaria, and urticaria is quite a common skin condition, but then people are not very aware about it. So, the whole purpose of having this session is to spread awareness regarding urticaria. First of all, Doctor, to start with, what is urticaria?
So, commonly in common parlance, we call it wheals, yeah, or nettle rash. So essentially, our understanding as a layman is that whenever there is any allergy, maybe due to food, maybe due to a bite, whatever rash we get on our body is essentially urticaria. Now, if you look at it medically, what we see is there are these round or multiple round rashes which are raised from the surface of the skin, which are lighter in color, and the surrounding skin is red. Generally, they are very itchy, at least in the first couple of hours, and then they start settling after, say, an hour, hour and a half. The skin still remains red, and subsequently it subsides. So, this essentially is called a wheal or urticaria.
Right. You have very well explained, Doctor, what is urticaria and how does it look like. We would also like to understand what causes urticaria, why it happens.
So, Sayukta, like in medicine, everything has multiple reasons, and couple of reasons you have to understand are inbuilt. But to make it very simple for all of you to understand, urticaria could be two types. One is spontaneous. We just don't know the reason, it just comes and it goes away. And the second is induced. It is caused by something. So I'm going to first talk about spontaneous, which is like it just comes and one just doesn't know why. And we need to analyze why it
Sure.
comes. Now, in spontaneous urticaria, again, we divide it into two types depending on how many times and how have you seen it. So, if it is only in the last 6 weeks, suppose, and you've got it once or twice a week in the last 6 weeks, we call it acute urticaria. But if it has been prolonged, it is more than 6 weeks, it comes, goes, sometimes every week, sometimes once in 15 days, sometimes every day, but it has lasted more than 1.5 months or 6 weeks, we call it the chronic urticaria. Now, to understand why we're getting this acute urticaria essentially is due to something that has happened here and now. So, probably you've got an infection, say, you've got sinusitis, you've got upper respiratory infection, or maybe food poisoning, or, just a recent bout of, say, COVID or dengue. You can get acute urticaria, which lasts for a few hours and settles on its own. But if it is chronic urticaria, which is lasted for a very long time, the reasons are different. Now, you may ask me that sometimes we notice urticaria due to, say, using wrong makeup or probably some, cosmetics or some deodorant that we use. All of that comes under acute urticaria. So, suppose you've gone on a vacation and then there are bug bites and you see this red rash coming up, that is an acute urticaria. So anything that is here and now which has happened comes under acute urticaria. The good news here is that acute can be cured immediately. The minute the offender has been removed, the urticaria subsides. But in a chronic urticaria, we really need to find the cause and treat accordingly. So this is the spontaneous urticaria. But some urticarias are induced, which are caused due to something. And the commonest amongst them is mechanical urticaria. So suppose I just, draw a line like this, and if this line within the next 10 to 20 minutes gets raised up and it is red in color, we call it a mechanical urticaria. Sometimes, we wear a tight pant or a belt, and you notice that around the waist it has become nice and red. That is again, an induced or pressure urticaria. And Sayukta, in some patients we notice, which is very funny, is it's caused by heat. So when you take a hot water bath and you come out and your body breaks into a rash. Similarly, in a cold environment. Similarly, after exercises. So all these come under urticaria. But as a clinician, then we understand and give it the right treatment.
Mhm. I think, as you were describing, I think anything under the sun and the sun itself can cause urticaria. So, yeah, but
Absolutely.
yeah. So now at least we know that, acute urticaria that way is quite easy to tackle because you know that what is triggering. But yeah, in chronic is where the problem rise because you don't know what is the cause. We'll talk about it at length later on. But before that, doctor, is urticaria a serious disease if not taken care of or not taken proper advice on it? Can it become life-threatening in future?
Yeah. So, urticaria in its simplest form, is very easy to tackle. Just take an antihistamine and it's gone. But many a times the body throws a big reaction. And in that you start noticing swelling of the lips, swelling of the tongue, the eyes, and at times even the windpipe. And that's when we call it an anaphylactic shock, when the patient goes into shock and can't breathe. Now, when that condition comes, it becomes life threatening and the patient needs immediate attention. So, yes, it's a spectrum. It can be very simple and just itchy, but it can become life threatening. So, we need to know about this and we need to be aware what our body is and how it reacts.
Right, so it's important to understand what is triggering urticaria and also to address the issue. And for that, you need to go and consult a qualified dermatologist. Now, doctor, a very common practice in our society is to go for home remedies or over the counter medication or going by what the influencers on various social media platforms are saying. Now, because we know, okay, it's due to some allergy, we can easily go to the chemist shop and ask for an anti-allergen, or because for any infection or any irritation or any rash, the best home remedy we have is to apply something, apply an oil, apply aloe vera, apply anything that we get hold of. Now, are they useful and or they could be harmful?
So, a certain home remedies like just putting coconut oil or aloe vera gel or lactocalamine, it does soothe the symptoms. But, unfortunately, we cannot understand the cause. So, unless and until we don't go to a doctor, we do not understand why this has come. And chances are that it will keep coming. And at one stage, it might get very serious and, as I said, life threatening. So, very important to maybe for the time being apply something so that it soothes your skin and the symptoms, but immediately go to a doctor and sort out the cause of urticaria. That is very essential. Over the counter medications, that is antihistamines, which probably the chemist will give, again will subside the symptoms for that attack. But subsequent attacks can get life threatening. So, very important to know the cause, which is why you need to go to an expert.
Okay, so it's very important to go and consult a dermatologist because if left untreated, it can even become life-threatening. Even if the number of cases are less than that, but still we have to
Yeah.
be very careful. At least we should know what is causing it so that we can avoid that particular trigger. Now, talking about the chronic urticaria in detail, doctor, a very common question people often ask, especially patients with chronic urticaria. will it go away permanently? What's your answer to that?
I wish I could answer, dear. Chronic urticaria, one has so many causes. But if I have to go down on statistics, about 80 to 90% we can't find the cause. It's that bad. So another 10 or 15 or 20% that we know causes, yes, of course, we can treat and we can reduce, the level of urticaria in those patients. But as I said, 80% we do not know. So what we do is we try to control the symptoms of the patient. We try and analyze what could be the cause, like by doing certain blood tests, by understanding the history of the patient, the lifestyle of the patient. Maybe it's a familial disease, maybe it's heredity. So try and understand what were the medical histories in the family, and also then to educate and counsel the patient. Because, one thing is that urticaria is, in general, especially chronic urticaria, is not life threatening. It's only the acute variety that causes the anaphylactic shock. Generally, chronic just does not. But the effect of chronic works mainly on our psyche, because you see the rash, you get the itching and burning sensation. Sometimes you have sleepless nights. That can affect the quality of your life and cause depression. So, today, if there are any patients listening to us and, they are suffering from chronic urticaria, I just want to tell you two things. One, do not worry, because this is not going to damage your life or your body. And secondly, do not forget to take your medications. At times, we think that we do not want to take so many chemicals, we don't want to ingest it, it might harm our body. But in general, the chronic urticaria medications that we give are practically safe. So they do not cause any damage if taken in the long run. So do not feel, completely sad or depressed and that I can't do anything about it. You can. You can work on your lifestyle. You can look at the trigger factors. You can be more positive, take your medications regularly, and do not worry.
Yes, so most important thing is to don't worry, do not worry, and in case you have these symptoms, please go and consult a qualified dermatologist because at least they'll help you in controlling the situation, in giving you relief. So there's no point in suffering in silence, and because it's very annoying, it's very
Yeah.
itchy. Many a times people stop going for socializing or in public events because they are so embarrassed with their situations. So it's important that because there are medications, there are treatments, so don't worry, go to a right person, which is a qualified dermatologist. Don't fall for quackery or over the counter medications or home remedies, etc., etc. Go to the right
Yeah.
person. Now, doctor, because we are talking about urticaria, so I think this is the right time to also understand when a patient comes to you with these signs and symptoms, are there tests that you normally recommend? And then what are the treatment options available?
So, sometimes acute urticaria comes, we just go to the history. We try and figure out and we zero down the actual cause of the urticaria and we stop that and it's fine. But when it comes to chronic urticaria, yes, we begin with very simple investigations, like we do a complete blood count to check what is the eosinophil or the allergic component in the blood. Secondly, we do certain immunoglobulin tests, especially IgE, because sometimes chronic urticaria is autoimmune mediated. So if we need to treat that, the treatment is a little different. So we do the IgE levels and we do certain tests to figure out if it's autoimmune, like we do an ANA analysis. In very rare cases, when the urticaria lasts for more than 24 hours, that's when we do a skin biopsy to check if the local blood vessels are involved or not. So, roughly, it's not a very, procedural or not very investigative heavy disease. It is more clinical and history based disease.
Right. And what are the treatment options available, doctor?
So generally, see, if you look at the physiology of why this happens, is that in our blood, like we have red blood cells, white blood cells, we have one cell called the mast cell. Now, this cell gets completely aggravated when we have an allergen in the body. So this cell will burst open, and when it bursts, it releases certain agents. One of the commonest is histamine. And histamine essentially causes the rash, the itching, the raised skin, the burning sensation, everything is caused by histamine. So the first thing that we do is we block the histamine. So we give antihistamines and they reduce histamine, so they reduce the symptoms of urticaria. So that's the first line of treatment. If that doesn't work, and we know that there are other causes, like an autoimmune cause, then we have to go to the second line of treatment. And in second line of treatment, we have sometimes we have to use topical steroids, we have to use oral steroids, we need to use certain other immune modulating drugs, maybe a methotrexate or a cyclosporin, depending on what is the cause and how it is progressing.
Correct. And many times, what happens, doctor? I'm sure you also get patients, doing the same. For example, they are the patient of chronic urticaria. They have the prescription with them. They know their medicines, etc., and they are taking it religiously. They are following the prescription. But when they see that, now it's not bothering them, they have got the relief, even if the duration of the prescription is not yet over, but they'll stop the medication by themselves. They won't even inform the doctor, not even keep the doctor in the loop. And again, in another maybe 1 or 2 months, when they'll start having those symptoms, they have the prescription with them. They'll go get the medicines and start them once again. Is it okay to do practice, or we need to follow the prescription?
That's a great question. And this is such a good platform to educate people that please do never do that. Whatever it is now, it's so easy to just write a WhatsApp message to your doctor saying that, Doc, my symptoms are subsided. Can I stop the medicine? Instead of taking those decisions on their own. So, whichever medicine, be it a very simple cetirizine or an Allegra, or a very strong, say, methotrexate or cyclosporin, be either case, it's important that you follow the entire prescription. Go back to the doctor in case you have any questions. And if you have to restart it, do not start it on your own. Always go back to your doctor and get it signed once again, even if you have to restart. Now, the reason being is that a very harmless drug, also, if taken for a very long time, can have certain side effects in the body, which probably neither the patient nor the chemist knows about. It's only the doctor who knows it. So important, even if it's a small tablet that you're taking, do not take it beyond the prescribed duration and never start it on your own. That's important. Yeah. So, urticaria cases, very, very important. Do not overdo your prescription. Don't underdo your prescription.
Right, doctor. So it's very important, A, to go to a qualified dermat in case you have the signs of urticaria. B, trust your doctor. Follow the prescription. It's really important. And of course, if you know the triggers, then please try to avoid them. Doctor, I can imagine patients who have urticaria because they are continuously, itching, and they have these rashes, and they have the stress of the whole condition. Do stress also aggravate or lead to urticaria?
Yeah, like earlier we wouldn't believe this, but now medical, so much of research is happening on psychosomatic stress and that leading to certain skin diseases like urticaria. So we have now very, very promising results that when especially an adult undergoes stress, there are certain hormonal changes that happen in the body, which subsequently stimulate the breakage of these mast cells. And that's when we see urticaria. And believe me, sometimes I think it is a vicious cycle. When you get urticaria, maybe due to some other cause, you get stressed and it adds on to your urticaria. So it just becomes a vicious cycle. So again, I repeat that urticaria is not a big disease that one needs to get worried about. It's a disorder. And disorders are never life threatening, especially chronic. So, not to worry because that stress itself could be a trigger for another attack.
Right. So I think, yeah, that is the silver lining. Even if chronic is bothering you more, but at least it's not life threatening. Plus, it's a discomfort, and we have, ways to control it and give you relief. So that is the good sign. That is the good news. And for that, you need to go to the right person. Again, I'm continuously emphasizing on this because it is important to go to a qualified dermatologist. Many times, patients also complain that their urticaria or the symptoms become worse during night. Is there a correlation with that?
There is, and one of the reasons is temperature. So, a lot of these urticarias are thermal mediated. Some of them are heat mediated, some are cold. So, when the temperature falls, urticaria can increase. So, that is one. The second also could be pollens. So, many a times there are certain trees which transmit or propagate their pollens at a particular time at night, because it needs to propagate. Now, these pollens itself can cause allergies, and that allergy can cause an urticarial rash. Like, we notice asthma, which starts increasing when the temperatures drop, start increasing in certain weathers because the pollens start getting secreted in the atmosphere. So, I'm from Bangalore, and in Bangalore, because of the trees around us, we see a lot of cases of urticaria and asthma in our winters, because that's when the pollens are released into the air. Also, at night, we notice in some cases that, the whole day the body is working. So, there is a lot of heat mediated inside the body. The BMR is high. When that comes down, again, urticarial rash can surface.
Right. And many times patient complain that, I'm so tired, I'm feeling so fatigued. So it is also due to urticaria?
So what happens is urticaria, since it's a disorder, it's taking away a lot of our immune system towards it. So our repair mechanisms for the rest of the body suddenly come to a halt because the entire body is now focused to treat that patch. That's the reason the rest of the body suffers, and that is why you feel very drained out, you feel tired, and you start noticing other symptoms. Sometimes you feel difficulty in breathing. You notice that, if it's an external allergen, your eyes start itching and become red. You might develop certain joint pains, you might get headache. So a lot of other systematic symptoms also you start developing once you notice urticaria coming.
Right. And doctor, is there any dietary precautions, any do's and don'ts for the patients of urticaria?
So, see, sometimes urticaria is, propagated or triggered by certain foods. Generally, it's seen it's less than 1%, but I think we all need to be aware of it. The commonest causes could be like seafood, prawns, shellfish, then mushrooms, certain variety of mushrooms, walnuts, berries, all these things when ingested, even peanuts at times, when ingested, can induce an urticarial rash. So important for us to understand, is there any correlation? So like today I've had a walnut cake and I developed, urticarial rash, and maybe a week later I had walnuts and I again developed the rash. It's important to correlate the two. So, yes,
Right.
food can be a trigger, and we need to be aware of that.
Mhm. This maintaining a diary, especially after your first encounter with urticaria, is it a good idea?
Absolutely. Every patient of acute urticaria that comes to the clinic, we always advise them either to write it on their phone or maintain an Excel sheet or in a diary. The time that they develop the rash and 24 to 48 hours before that, what have they consumed? Very simple things like, even a banana. The
Hmm.
basic things also to mention, and each time they get that, to write it down and then, just tally, is there anything that is constantly present before they're getting a rash, and we get the culprit very easily.
Right. So easy way to pinpoint the culprit is to maintain the diary. And
Yes.
doctor, because we are continuously talking about urticaria, and as you said, there are few triggers, and food could be one, and then few items that normally, I mean, most of people have allergy with egg or cheese or seafoods, etc. But then many a times people make it a blanket list that even if you don't have urticaria, even if you are not allergic to these, don't they won't eat them. They'll make it a rule, a protocol at their homes, and I'm sure you also have patients who do the same. So, what? How would you like to address this situation?
So, see, unless and until proved, no, I don't think we should stop eating anything. Because again, I'm repeating, urticaria, especially chronic urticaria, is not a disease, you know. So, if we start stopping or omitting certain things in our diet, which subsequently doesn't cause urticaria, we're just losing out on living, you know, and we are making ourselves like we have a disease or like we have a disorder, like a problem, you know, and that just takes away the fun of life. So unless it's proved and unless you go to a doctor and actually corroborate that this is the issue and this is the problem, I don't think we should stop eating anything. Everything is okay unless proved not right.
Absolutely. And then because there's so much of information these days, we have influencers, so much of information, data on one click. And what people do normally is to go to labs on them without consulting their doctor on and get their allergy test done. And then
Yeah.
they go to the doctor with the list that I'm allergic to 50 or maybe 100 food items. So,
Yeah.
and they are not very pocket friendly as well, these tests.
Absolutely, absolutely. You read my mind, you know. So that is what I tell everybody, that do not do these tests, because when you do these tests, you actually notice you're allergic to dust. Now, in a country like India, where can you get no dust zone, you know? So, or you're allergic to tomatoes or things like that, which you just can't avoid. So, the best thing is not to do all these things on your own unless advised by the doctor. Yeah, it's always better to do a trial and error at home. As we discussed, maintain a diary, understand your pattern, and avoid that, rather than do these very cumbersome, expensive tests and then live with that kind of, boja on your heart saying, oh my God, I have this big condition and I can't eat A, B, C, D. It's just too unnecessary. So one needs to visit a doctor, discuss, understand what is essential, and only then go ahead and do these allergic tests.
Doctor, many times we see people who just had UTI or maybe a viral infection, viral fever. Even during COVID, we had so many patients who complained of hives or urticaria. So, is there a relationship between viral fever or any other infection and urticaria?
Yes, yes, absolutely. Any infection, any acute infection, like you said, COVID, malaria, you know, even diarrhea, any viral
बहुत
infections
बुरा नेटवर्क है सब कुछ खटक खटक रहा है
can trigger an urticarial rash. So, any infections, that is why for acute urticaria, even if we don't have a history forthcoming of any infection, we do give them a short course of antibiotics, because there could be just a subclinical infection which is triggering a urticarial reaction. So, yes, any infections can cause urticaria. And while we are at it, I just see a couple of questions. Mr. Ajit has asked if this is chronic urticaria is a lifelong condition. Ajit, I think it is a lifelong condition unless we find the cause. And to find the cause and to treat it correctly, you have to work on it, because you got to figure out what is the trigger in your body. Is it stress? Is it acidity? Is it constipation? Is there a particular pattern to my urticaria? And try and control that. If you can do that, you can get rid of urticaria very early. And someone has written that, can it affect the eyes? Yes, especially if it is an external stimulant. If it is because of pollens, because of certain dust mites, or even cement, if there is like a local construction happening around your house, then it can cause urticaria. It can affect the eyes. And of course, Deepak has asked, it can cause joint pains if it is associated with, say, a mixed connective tissue disorder or maybe an arthritic phenomenon. Yes, it can cause joint pains. And it's important then to investigate to find out why we are getting, the urticaria along with joint pains, and find out the cause and treat it accordingly. Yes, it's important to do that.
Yeah, there is some network issue and some technical glitch. So, are you getting my voice now, Dr. Rami?
Yes, yes, I can hear you. And in the
Okay,
interim, I just
correct.
answered the three questions that were
Ah,
asked. I think there is a little technical error going on. So, in case anybody has any questions, please you can ask. But to take Urticaria a little further, I think ma'am's here. Yeah.
doctor, I'm so sorry. There was this glitch, technical glitch again. Yeah, no problem. We can just continue, and we have already addressed the questions which
Yeah.
our viewers have asked.
I've just said, yeah, the three questions that
Okay,
are there on the
so
screen. Yes.
yes, yes. So you have already addressed because I was not in the meeting, I was moved out of. So
Yes.
anything that you would like to tell to our, audience that how to take care of yourself, how to take care of your skin, and why it is so important to consult a doctor in case you have any symptom.
See, I think everybody needs to understand that skin is just not for beauty. It's a mirror of our inner self. So when you notice something that is going wrong on your body, it's not that you have to go to a beauty consultant or a beauty parlor or probably go online and check an influencer who's talking about it. It's very important that you go to a specific or a specialized doctor, a dermatologist for your skin conditions. Anything, be it an urticarial rash, be it a simple acne, be it a little bit of pigmentation, be it a sudden patch of dryness, because we don't know how it can relate to a disease within. Like one of the people have asked, can urticaria cause joint pains? So essentially, urticaria doesn't cause joint pains, but it is the first manifestation of a mixed connective tissue disorder. So if you have like an autoimmune disorder in the body, it can manifest as urticaria in the skin. And that only a doctor, a qualified doctor, will be able to diagnose it. Over the counter or an influencer on Instagram or a chemist is not able to correlate the two. So, very essential that if anything is to do with the skin, do not take it lightly. Do consult your dermatologist and take the exact treatment. The second piece of advice is that when it comes to skin, it's a very slow growing organ. So you cannot expect miracles in just one day or one week. Because it's such a slow growing and a slow process, you need to be patient, perseverant, and very, very disciplined with the treatment protocol. I see many a times patients start with a lot of enthusiasm, and by the time they finish 1 month, everything is fizzled out because they don't have the faith and trust. So, today in this platform, I'm just going very live and telling you that please bear with your doctors, because skin is such a slow growing organ that you need to be very patient with it and keep doing it till finally you see the result. So, two very important things about skin. And I hope that you always take care of it. Look at very simple changes. Like a simple example, I'll give you: under eye dark circles. We always think it's because of the phone usage, because of the laptop, but it could just be iron deficiency, and that can affect every part of your body. So, very important, if you notice even small changes, do not jump to your own conclusions. Do visit an expert, take the right course of action, and you should be fine.
I think there's so much of information adopted these days. We have influencers. I'm not blaming them, but then they are not always dermatologists. And what happens? They tell us that you can do this, you can try this, and we blindly started following them. I have seen people doing chemical peels at home, which is, I mean,
Yeah,
I don't know how can a person do a chemical peel at home, but then influencers are telling them how to do it. So it's so great. Ultimately, I think we also need to understand they are also endorsing a product. They are also making money out of it. So it's a business. It's
absolutely.
just like you watch a ad on a TV. So yeah, you
Absolutely.
would like to say
Yeah. So, as you rightly said, it's not that we're against influencers, but I think as an influencer, as a celebrity, one needs to put their foot down and say, look, I'm not going to speak this, because if you look at in the in the entire spectrum of so many thousands of followers who are going to watch you, unless and until you're not sure about a particular product, one should not talk about it. That kept aside, it's their profession, we should not judge too much. But as a consumer, it's very important to pick up the knowledge, to understand, to go into the depth of what probably you are looking at. But when you make the decision, it's always best to cross check with an expert, because as dermatologists, we've spent 10 years of our lives just understanding the body, the skin, and its manifestation, which probably a 10-minute influencer is never going to gain. So, so with some respect to the knowledge and the art effort, I think people should go and visit an expert. And, believe me, people think that, niacinamide to lagaya hai, kya badi baat hai. But that niacinamide, if not used the right way or the right percentage, it can harm your skin in the long run. So these are the things that we need to really check. And unfortunately, with India being the startup hub, and we've got all these VC funding and investors pumping in their money into these startup organizations, and they in turn are paying these influencers. The entire beauty and skincare market has become very cluttered and confusing, and not very right. That environment is not very good, and which is why I think we all should be very wary. Learn, understand, provide as much knowledge as you can, but do not pick up unless you speak to a right person.
True, true. We should never take our skin lightly. What happens when we have a chest pain? We go to the right doctor, which is a cardiologist. We won't settle down below that. We won't go to a chemist ki, "Arey, heart attack aane wala hai, kuch de do." We'll never do that. But with skin, I think we are so generous. We are so, experimenting. We'll keep on experimenting. And as Dr. Amy have very rightly said, skin is just not about appearance. Way down, it is the mirror to our health. It tells what's going on inside us. So please take care of it. It's really important. Before Dr. Amy, we wind up the whole session, any take-home message for our viewers?
So I think, I have actually said everything, but very important, when you're suffering from any itching, any, red rashes or anything, I have noticed that people stay back. They try to analyze, they try to think, they spend a week, just thinking, and it becomes too much, and then come to a doctor. That 1 week of tension, apprehension, anxiety can be brought down by immediately going to the doctor. So that one shift, I think we all should make. And believe me, Samita, we are so lucky to be in India, where a doctor is available at any given time. If you look at anywhere abroad, be it UK or be it US, you got to wait for weeks before you can actually meet a specialist. So we are so lucky to have this on our fingertips, and I think we all should make use of that. Immediately go and meet your doctor. It's just a matter of what, 500 to 1,000 rupees, but it saves a lot of stress and anxiety later. So that I think we should. And to set that, people who are diagnosed with chronic urticaria, do not lose hope, do not get depressed. It's just a disorder, and you can control it. It's in your hands.
Absolutely. If you want to save money, time, energy, and most importantly, your skin and health, please go to the right person at the right time. As soon as you start having the issue, please consult your doctor, a qualified dermatologist, in case it is related with your skin, scalp, nails, etc. Thank you so very much, Dr. Amee Daxini. It was so wonderful talking to you. Thank you for your insights and making this so informative and so informative for our viewers.
Thank you. Thank you very much for having me on this platform, and it just helps me reach out to people which, probably I could not meet otherwise. And it's my pleasure always.
Thank you, Doctor. It was a pleasure altogether. And the viewers, thank you for your active participation. Stay happy, stay healthy, and do not forget to like and follow our FB page all about skin well-being. Take care of yourself. Goodbye.
Bye.